Welcome to SoCal Tech Interviews, where we talk with the startup entrepreneurs, investors, and others in Southern California's high-tech industry. Today's interview is with Chris Straka of Radcare Health. I'm Ben Kuo, founder and editor of SoCalTech.com.
I'm Chris Straka. I'm a radiation oncologist at UC San Diego. My company is called Radcare Health.
And what does Radcare Health do?
We are trying to disrupt the patient education space. So when you go online right now and look for information, everything says you have cancer. And if you actually do have cancer, it's even worse because you can't figure out what is going to happen to you or why. So we're going to take the concept of teaching a patient what they need to know, and instead of giving them everything all at once, we're going to give them curated, actionable, and accurate information that they can actually use, and only give them just that information just in time.
And how far along is your startup?
Well, we have a prototype right now in the iOS store. It's called Radcare. It actually targets prostate cancer patients getting radiotherapy treatments, so my area of expertise. We're hoping to expand that to the 3 most common cancer sites: lung, breast, and then including prostate cancer, and then start marketing this to actual healthcare systems to give to their patients.
So, as an academic and obviously someone who's in the research area, why did you decide to start a company around this?
Yeah, so my dad actually had prostate cancer, so something I treat every day. He lives on the other coast, so he was treated by a different radiation oncologist who was great. But my dad had a lot of questions throughout the journey. He went online, was very discouraged at what he found. We were on the phone almost every day throughout his 8-week course of radiation treatments, and I realized that I could actually commoditize that and create something that my patients could actually use. I can't be available in that kind of way to every single patient, no doctor can, but this actually is not meant to replace, but to complement the doctor-patient relationship. And in terms of keeping that in the academic route or going along the business route, it just seemed to me like something that actually had a potential really widespread and rapid market adoption. And so it seemed like something I could have written a paper about it, but I figured my time would be better spent actually coding the app and putting it in front of patients.
Interesting. So what's next for your company? What are you working on now, and what's the
we're looking at raising some very early sort of pre-seed funding to get that sort of next stage MVP that I talked about, supporting a couple more disease sites and with a little bit of added functionality. And then we actually want to get some market traction by marketing this to hospitals. We'll start with the UC system. Kaiser has a large footprint down here, Scripps down in the San Diego area. And then we're also right now conducting a clinical trial with our initial prototype in the App Store to validate that and to actually sort of get some publication out there, some real world data showing that this app is usable and useful for our patients.
What's the hardest thing for your startup to do?
I think
Let me rephrase that.
Yeah.
What is the biggest challenge for you as a startup?
I think our biggest challenge as a startup is this. We have all the medical information and very little business experience. So I'm looking both for a small amount of investment capital to help grow, but also for potentially a partner or someone to come alongside and sort of help guide the business side of this. I can provide all the cancer information, as can my co-founder, who's also a physician, but we don't have sort of the business expertise yet, and we're hoping to attract that.
What's the biggest lesson you learned as a new startup entrepreneur?
It's harder than I thought it was going to be. It took me about 6 months to get the initial prototype app into the App Store. I was working with a third-party developer, and so I think if I had an in-house software engineer, that could have gone a little faster, but it was a lot of work. I did a lot of iterations with the content with patients, and it's actually much easier just to write a paper and put it out there. When you try to create something that's useful in the real world, it takes a long time and a lot of refinement.